substance use and mental health. For those of you who don't know me, my name is Gabby Schumann, and I work for Helping Services for Youth and Families as the mentoring coordinator for Delaware and Southern Fayette counties. If you're unfamiliar with that, we'll kind of talk about that in a couple slides from now. But the overall purpose of this training is to provide a better understanding of the correlation between substance use and mental health. We'll explore how these issues intersect. We'll discuss their impact and talk about available resources, because there are resources available and we want people to know that they don't have to struggle alone. So, before we start, I just want to acknowledge that some of the topics we discuss may be difficult or triggering to individuals. So if at any point you feel uncomfortable, please feel free to step away or take a break, because your well-being is what's important. And we want to ensure that this session remains supportive and helpful for everyone. Some housekeeping there. These are just reminders so that we can have a smooth experience. So first, please sign in using the chat box. So include your name and email address. This is so we can take attendance, and also we'll send you the presentation in PowerPoint through email afterwards. You are welcome to keep your camera on, but please do make sure to mute yourself so then we can avoid any room distractions. And then lastly, feel free to ask any questions in the chat box. We have Colleen here watching the chat for me, so she'll let me know if anyone chimes in. And then the last thing I want to take a moment to discuss before we dive into our topic is youth mentoring. So as the mentoring coordinator, part of my job is to provide these training sessions for any youth mentors or anyone in the community. But youth mentoring does strive to navigate youth away from risky behaviors, because all youth are at some level of risk, even though they're probably not engaging in some of these risky behaviors like substance use. They could down the road fall into using. So our goal is that when we have mentors and mentees matched, they can develop a positive relationship that can lead them down to creating positive behaviors. But if you're interested in learning more about our mentoring program, you can visit our website at helpingservices.org/mentoring. We definitely love for you to get involved if you can. Okay, so to ensure we start with a solid foundation, I'm just going to define some key terms. These will be mentioned throughout the presentation, which is why we're starting here. So first, substance use disorders. I'll mention it, and it's kind of throughout the presentation. It's also called SUDs, and these are medical conditions characterized by the harmful use of substances. It's a compulsive substance use despite harmful consequences, and it includes cravings and inability to stop. And substances are things like alcohol, drugs, misusing prescription drugs, stuff like that. Then mental health, this refers to a person's emotional, psychological, and social well-being, and this affects how we think, feel, and behave. Note here is that we all have mental health, just like we all have physical health. But this mental health just refers to how individuals handle stress, how they relate to others, and how they make decisions. And then mental health disorders, on the other hand, are diagnosable mental health conditions that can significantly impact a person's mental health. So mental health and mental health disorders are different, and not everyone will struggle with a mental health disorder. The last definition is co-occurring disorders, which we'll discuss this a bit further, but a solid definition of this is the presence of multiple mental health conditions and/or substance use disorders in the same individual. So it could be someone struggling with several mental health conditions and not substance use disorders. But today we'll talk about the co-occurrence with mental health and substance use disorders. Another note here is that if you see either dual diagnosis or comorbid, these are the same things and they're used interchangeably. So just know that those are the same thing. Okay, so we're going to start by watching this introduction video to help us understand the connections.
Advisor with Northside Behavioral Health. Today I will be explaining co-occurring disorders. This is the coexistence of both mental illness and a substance use disorder, also known as dual diagnosis. The interaction between the two disorders worsens the course of the diseases. Substance use can trigger psychiatric illness such as depression, anxiety, and even psychosis. Common mental health disorders are depression, anxiety, and post-traumatic stress disorder. Many people who've experienced trauma turn to substances to try and cope. A substance disorder is actually a complex, chronic, and progressive brain disease that literally causes deterioration of the body and the brain, and of course, the mood worsens. People are not enjoying themselves during this process. They're not partying, they're not having a good time, they're seeking relief, they're trying to survive. The good news is that treatment works. People do recover and lead happy and productive lives. Again, this is
Okay, yeah, so we can see that there is a connection between mental health disorders and substance use disorders, and this connection is complex and often creates a cycle that is difficult to break. So individuals may start turning to substances as a form of self-medication in order to cope with their symptoms. So if they're feeling pain, they might turn to substances. And then vice versa, a person with substance use disorder, it can lead to worsening of mental health and just worsening what they're feeling. So untreated co-occurring disorders can exacerbate both issues regardless of where it started. And that's why an integrated treatment that addresses both substance use and mental health is crucial for breaking that cycle and starting long-term recovery. So then here are some statistics that help us better understand the relationship between the two, because having that hard data is something that gives us a clear picture. So we'll just go through these real quick. The first one is that over 17 million Americans over the age of 18 have a mental health disorder, and then 4 million of those 17 million also struggle with a substance abuse. And then those with a mental health disorder tend to account for 38% of alcohol consumption and 44% of cocaine consumption. And then the last one, over 6 years, the percentage of those seeking dual diagnosis, so those co-occurring disorders, those seeking that treatment increased from 12% to 16%. And even those percentages might not seem drastic at first glance. When you think about it in terms of individuals, it's definitely a huge increase and a problem that is present. And wrapping all those statistics together, it shows that there's a correlation. That doesn't mean that there's always going to be co-occurrence, but it does account for a good portion of those who are struggling. And then a question that can come up is what mental health disorders commonly co-occur with SUDs, substance use disorders. And this is certainly not an exhaustive list, but these mental health disorders have shown to be more common to have that dual diagnosis with SUDs. So that includes anxiety disorder, major depression, post-traumatic stress disorder, disorders of psychosis, as well as borderline and antisocial personality disorders. So now the question is, why should we care about this? Why is it important that we understand substance use disorders and mental health disorders? And one answer to that is that both have a huge impact on individuals, families, friends, and communities. The effects affect more than just the individual struggling, and that's an important thing to know. So we'll go through this. We'll start with individuals. These are often the effects that might be more obvious to some. So focusing on substance use disorders, the individual risks short-term effects on their health. So an example, while a person is intoxicated, they can experience impaired judgment and coordination that puts them at risk of getting in an accident or having other injuries. And those injuries can lead to long-term effects. So if someone becomes paralyzed from drunk driving, that becomes a long-term effect. But some potential long-term effects besides that include liver damage, heart problem, premature death, cognitive impairments, so long-lasting effects of memory, focus, and decision-making. All of those problems definitely highlight that an individual's health can be drastically impacted. There's also a higher likelihood of social withdrawal from loved ones for both substance use disorders and mental health conditions. And we know that connections with others are important and it affects our overall mental health. So not getting that quality connection can make a person go downhill further and just go throughout the cycle. Financial consequences. So for substance use disorders, the cost of purchasing substances can drain finances, making it hard to even afford basic needs. SUDs and mental health conditions can also lead to loss of job because the condition might take over and affect their work efficiency. And we know that income is important. And no longer having that income coming in can affect someone's ability to receive basic needs, especially when they don't have an adequate amount of money saved up. And then this pours over to friends and families. So there can be a large emotional toll on relationships when these conditions bring stress and anxiety within households or friend groups. And there may be unpredictability in the actions of the individual who's struggling. If it's a parent, neglect or anything like that can take place just because they may be focusing more on the condition just because it's an addiction and it can kind of take over a person's life. And it's not their fault, but it can affect their family and friends as well. And then financial, like loss of income, if their parent loses an income, we know that that also translates to the family as well. So, school and family and communities, there is a link between substance use disorders, mental health conditions, and an increased crime rate. That includes domestic violence, theft, assault, drug trafficking, any of those. I do want to emphasize that not everyone struggling with either of these conditions will resort to a life in crime, but it can happen for different reasons. It could be because they need the money to support themselves and their families. And when crime rates do increase, that affects the community. There's also an economic impact on community. There's likely going to be financial strain on healthcare with increased emergency visits, long-term treatment, mental health services. And that just creates a higher demand, which again, these services are important to have available, and we want to have them available, but it does create a strain sometimes. productivity, loss of productivity in the workforce. We talked about this affecting individuals and families. It can also affect employers and just the economy in general, as there's lost outputs and just the cost that it takes when losing an employee. So yeah, with all that being said, we should care about these issues no matter what domain it affects. Even if it only affected the individual, which we know it doesn't, we should still care, not only because of the consequences, but also because we want every generation to have a better future. We want them to uh, kind of, we want them to avoid the impacts that we just stated. And that's why prevention efforts are so important. And when people are struggling, we want to support them by giving them help with resources. So then the cycle doesn't continue. Okay, now we're moving into the risk and protective factors. I'm just gonna have you go ahead and raise your hand if you know what risk and protective factors are, or you can use the little. Okay. Well, a short definition for those of you who don't know or you need a refresher. Risk factors are characteristics or exposures that are associated with a higher likelihood of negative outcomes. We'll talk about that further. And then on the flip side, protective factors are characteristics or exposures that are associated with a lower likelihood of negative outcomes. So these factors help us determine whether an individual is more likely to develop either conditions. Someone with several risk factors are more likely to experience negative outcomes than someone who has fewer risk factors. So it's just important to remember each individual experiences risk and pain differently. So not every person who has multiple risk factors will experience negative outcomes, but it's more likely that they will. And it can really just depend on the individual. But moving on to the risk factors, we'll start with that. So like the video stated, they can often overlap, and we'll talk about that. But we'll start on the substance use risk factors first in the yellow box. So first, if someone experiences peer pressure to use substances, this plays a major role, especially sorry, among adolescents. So if they feel pressure from their peers to use, then they're more likely to do so. Another thing is if they have early exposures to substances within the family or community. So this means that they're exposed to a life where substances are present in the people's lives around them. And this could look like it just being normal for people to use, and then they may begin to think it's normal as well. The availability of substances. So the easier it is to access substances, the more likely individuals are to use them. It's kind of like the out of sight, out of mind, but backwards kind of thing. Availability, oh, sorry, lack of parental supervision. So especially during those formative years, children need parental supervision to help them avoid risky behaviors. Also having a mentor that can help them avoid those behaviors as well. Another risk factor is if there's a low perception of harm. So that means individuals not recognizing the dangers in substance use, especially in youth. So when they don't see a problem with it, they're more likely to experiment because it's like the why not if it's not going to harm me type thing. Genetics play a role. So a family of addiction increases their likelihood of developing a substance use disorder. Early substance use. So if a child starts when they're younger, they're more likely to develop an addiction or just have dependence on it. And then moving over to the mental health conditions, risk factors in the blue. So neurobiological and chemical imbalances in the brain contribute to different mental health disorders. Genetics also play a role in the likelihood of experiencing a mental health condition. And the reason I put them in separate is because someone could have a genetic predisposition to mental health disorders and not substance use disorders, and vice versa, but you could put them in shared risk factors as well. A risk factor for mental health disorders is using substances. So like we said, it can worsen mental health conditions if you use substances. Living in poverty or facing ongoing socioeconomic stress increases that risk of developing mental health conditions. Gender and cultural factors. So, for example, women are more prone to anxiety and depression, or people in the LGBTQ community experience different stressors that can contribute to mental health disorders. And then lastly, poor sleep and physical health can impact the mood. So moving on to shared risk factors, there's ACEs, which means adverse childhood experiences. And these experiences can include abuse or neglect in a child's life. And this disrupts brain development and coping mechanisms that makes it a major risk factor for both. Limited access to support, being socially isolated, so not having enough positive relationships in your life, making an individual more vulnerable to developing either disorders. High stress environments can play a role, and major life changes, such as the loss of loved ones or new financial problems. Okay, with all that being said, there are protective factors, and remember, those are the factors that decrease the chance of problematic outcomes. So the more protective factors we have, the better off a child can be. So these factors can include having a strong bond with family, school, and community, having clear, consistent expectations from close influences on substance use. So if a family member has the expectation that children should abstain from substance use, then they're less likely to use because they have this influence that is letting them know that it can harm their health and it's an expectation not to use. Another factor is having a high level of understanding of mental health conditions or substance use disorders, and having that encouragement to help them get help when they need. So that means having low stigma on the conditions, having opportunities for positive social environments, such as being involved in a team sport or activity, recognition for positive behaviors and achievements from others, such as, or that just makes an individual more likely to look for more positive achievements in the future. Access to mental health care, spirituality, so having faith and a higher purpose, having positive role models to look up to, like a mentor, and having high self-esteem. So by strengthening these protective factors, we can help individuals build resilience against challenges that they may face in the future. So we can't have this conversation without talking about stigma. So this is the negative attitudes, judgments, and generalizations against groups of people. So for example, this could look like believing that someone is less of a person because they have an SUD, or assuming that someone will act a certain way just because they're struggling with a certain mental health disorder. This is public stigma. These thoughts can be subconscious, or they may just seem normal or valid because of what the majority or larger parts of society believe. And with this worldview, people who struggle can be considered scary, dependent, burdensome, and unable to make competent decisions, which we know is not true. There's also institutional stigma, which are policies the government or other organizations have that limit opportunities for people who are stigmatized. So this could look like not receiving the opportunity to rent a certain apartment because they know that they have the condition and they don't want to have one of those people trashing the place or something like that, or having fewer mental health services relative to other health care available in the area. Those are both examples, but there's much more that goes into that as well. And then that leads to self-stigma, which is when a struggling individual internalizes everything they hear around them about their disorder and begin to believe they themselves are the problem. So self-stigma, otherwise known as internalized stigma, starts with the individual recognizing the public attitudes and stereotypes out there, and then that leads to them agreeing with those stereotypes or believing that they're totally valid and true. And then they apply those stereotypes to themselves because they're struggling with the disorder, and their behaviors begin to be impacted by those beliefs. So they may start to think, well, I'm already too far gone and I'm a crazy person, so what's the point of even trying recovery because it won't work? Something like that, that can eventually become their internalized dialogue. So both substance use disorders and mental health disorders are highly stigmatized, and this stigma can encourage people to avoid seeking proper treatment when they're struggling, because they're very likely to feel shame, guilt, or fear of discrimination. And when they have those fears, they can try to avoid others finding out about their struggles. They can pretend like they're okay because they want everyone to think highly of them. And the reason they want to appear okay is because they don't want to be stigmatized or treated differently for their condition, which unfortunately can happen. This picture on the left shows the cycle that stigma can turn into. So there are stereotypes. There can be a division between us versus them. So us who don't have a drug problem versus those who do. And I put those in quotations, the drug problem, because it is stigmatized language, which we'll talk about in the next few slides. But individuals can be put into categories of low social status. They can experience intentional or unintentional discrimination from others. And they can be labeled. So saying a person is an addict, this turns the person into their addiction or condition rather than them simply being a person. So we all need to remember that everyone is a person regardless of whether they struggle with a mental health disorder or substance use disorder. There's nothing wrong with people who struggle with certain conditions, just like there's nothing wrong with people who break their leg or who experience any other physical health condition. So we're gonna watch this video, and this explains the concept of words mattering and keeping a person's first language. Oh.
Words can become grenades, strategically spoken at times to do the most damage. And when those words come from family and friends, they can cut deeper. Labels erased my humanity. Total strangers felt allowed to criticize or judge me, saying that I was just a drunk or addict. These words also carried the connotation that I was lazy, selfish, or criminal. After a while, I began to believe the words, concluding I no longer served a purpose or deserved hope. Luckily for me, these feelings were eventually replaced with words that provided healing.
The research is clear. Not only do words shape how we view people, but words also shape how we treat them. For example, studies show that when someone is described as an abuser or addict. The general public and even clinicians are more likely to believe that they should receive punishment over treatment. Tragically, for those with addiction who are looking to lead fulfilling lives, hearing the terms drug abuse or addict is paralyzing and demotivating. It blames people for their own illness, ignoring environmental and genetic factors. It feeds into the stigma they experience from society, their family, and treatment providers. To help decrease stigma around language, the Office of National Drug Control Policy recommends using person-first language to replace judgmental and negative terms. For example, a person with a chronic medical illness that impacts their brain is not an abuser or an addict. They are John with a substance use disorder. John, person who requires treatment and support to recover from his illness. Words matter. They can hurt and reduce someone's motivation.
Together, let's choose supportive, non-judgmental words that lead to treating people with respect and compassion.
Okay, so these tables, sorry if you can't see that as well, but these are examples of words or phrases we should try to avoid in order to reduce that stigma. They give recommended language based on consensus, research, and expert opinion. None of us are going to be perfect, and we're all going to notice ourselves slip into internal biases or catch ourselves using stigmatized language because we're human, and a lot of us heard this language growing up by people around us. I definitely noticed from this list that I've used some of these words because I thought it was the correct terminology and I didn't know it was playing a part of stigma. The one that really surprised me was the saying, like, she or he's now clean. And the reason that it's described to be stigmatized, well, first, clean, like people would use the term clean to say that, like they haven't been using like they used to use drugs or alcohol or any substances, and now they no longer don't. So that's what that term meant. But the reason that it can be stigmatizing is because the opposite is associated with dirty or with filth and not a medical condition. So the recommended language is she's substance free or she's no longer using. And that doesn't mean that every individual won't like the term, but they may actually use that term when describing their own recovery, but it can create self-stigma and invoke different biases and shame towards those who are currently struggling. So I'd encourage all of you to take a look at these charts and work on using recommended phrases instead. And the awesome thing with this is that we can always learn and educate ourselves and just improve the way that we think and the way that we speak. So the next one, that's another list. So how can we help a person in our life who's struggling? First, we want to normalize conversation surrounding mental health and substance use. So we don't want either to become a taboo subject. We want to always be supportive and listen when other people are sharing challenges in their own life. We never want to write off what a person is saying or assume that they're saying something for attention. Yeah, just let them know that they're welcome to talk about their struggles whenever they need. We also want to encourage a daily routine that involves seeing healthy friends and engaging in fun activities. So if you think your friend would enjoy going to a Bible study with you or joining a team sport together, or simply just opening up your home for the individual, that's a great way to encourage time with community. Also, when someone's struggling, we can help them learn new coping skills. That goes back to normalizing these conversations. We can be open to talk about ways that we personally cope with stress and encourage dialogue for them to come up with what would help them in high stress situations or during times of crisis. And lastly, we just want to be an advocate for those who are struggling, especially those who are close to us. This can look like standing up against stigma by educating yourselves and others. If you hear language, you can kindly talk about why that could be stigmatizing and then share another word that could be said. Or it could look like taking your loved one to therapy, just as a way to show that you're there to support in any way that you can. So now I'm going to welcome our guest speaker, Tiffany Lemery. Is that how you say your last name? Yep. Yeah, but she's the clinical director at Northeast Iowa Behavioral Health, and I'm going to let her take it away to talk about the recovery side of things.
All right. So my name is Tiffany. I am the clinical director at Northeast Iowa. I am a licensed independent social worker. I also have the CDC II, which is the chemical dependency counselor as well. Of course, I have my master's in social work. I have a specialty in trauma and interpersonal violence. And so I've done a lot within the mental health and substance use field. One thing that I will say is when we are looking at substance use, very, 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 very rarely is it just substance use. Like 99.999%, it is co-occurring. So, when somebody comes in to do an eval, we get an integrated eval. And basically what that means is we're looking at presenting illnesses, we're looking at psychiatric history, medical history, kind of everything that Gabby was talking about, the family dynamic, supports, the risk, the protective factors. We incorporate all of that into the evals, so we can really get a very good picture into what's being used for substances and then what's mental health, and making sure that we are treating both co-occurring. The approach is going to be different depending on the client. There's times where we got to work on substance use first, and there's times where we got to work on those mental health diagnoses first. And it honestly depends on the client as well. There's times where we're like, man, we've really got to work here, but that's not where they are. They want to work on this because they see, XYZ as the problem. So we really have to meet the client where they are. So they will get the treatment that they need. They don't want somebody else coming in and telling them what to do. They're here for help. We help them where they're at. So they come in, they get an eval done. Of course, we do a treatment plan with them. And then just at like Northeast Iowa, we have a lot of different options for them. Groups, I love groups. Groups help out a lot. It's different when it's one-on-one. I kind of explain it as like a child-parent relationship. Even though it's a therapeutic relationship, it's still one-on-one. When you have peers sitting with you, whether we're talking kids or adults, because co-occurring is for kids and adults as well. This isn't just dealing with adults. That peer support, hearing what's worked with other peers, what hasn't worked with other peers, that's huge. When they could support each other and just hear that, man, I struggled this week. Man, so did I. Like that, there's power in that when they can be open and vulnerable and see that they can still have successes. And that they're human. Things are gonna, we're gonna have barriers. So we do groups. We do IOP as well. IOP is intensive outpatient group. That is basically a group that consists of 9 hours a week. So they come in 3 days a week and they meet for 3 hours. We're going to do that when they have to meet a certain level with an ASAM score, but basically they've been in treatment before and it hasn't worked with a one-on-one individual counselor. They have more of those risks than those protective factors. So really not a good support system. Maybe they've lost their job. Maybe they have no license. Like, we're really looking in at the whole picture to see what those risks are and what those protective factors are to see if they meet that level for IOP. We also have the MAC clinic. MAC clinic is the medication administration treatment. So they actually use medication to help the cravings. There's one, if you take it while you're drinking, you will get sick. So there's medications that could actually help people within their road to recovery. Again, it's not for everybody. Some people don't want to do it, but it's an option that is available. Of course, there's always medication management as well. Now, the MAC clinic is more for the medication to help get off of substances, the alcohol, meth, there's different substances for that. Your medication management in Dubuque. Okay, so this is where, guys, I really stink at this because I live in Arkansas. I am remote while we're looking for a place in Decorah. I don't know if there's one in Dubuque. I don't know if you guys can answer that. Gabby.
Well, I have resources available. I'm not sure about that, but
I could look
We
into that
will
too. 'Cause
find out and we will let you know, Christy. I know that we have a MAC clinic here in Decorah, but I
Mhm.
don't know about Dubuque. But we can ask the right people who would know and let you know.
Yes. Mhm. So that's an option. And then med management is an option as well. And I was trying to think because I think we had a couple of clients from that way, but family lived up. It was weird, but there's always options. We can always get help. So medication management. So medication management is from the psychiatrist. They can also kind of prescribe some of the drugs as well. They're going to rely on a MAC clinic because a MAC clinic, you're going to see, of course, the nurse and all of that. But when we're looking at our mental health diagnoses, we're going to really rely on that psychiatrist. So they could see the psychiatrist. They can see them weekly, depends on their medication. Once it gets down to maintenance, we're looking at like once every 3 months, and then they're coming into therapy. Of course, we're going to start them at weekly. We're going to kind of titrate them to bi-weekly and then monthly, because the goal of therapy is not to be on therapy lifelong. It is to give them skills so that way they can learn how to handle their baseline of whatever that looks like. Again, we're meeting the client where they are, meeting them on their journey so they can get where they want. So that's kind of the treatment options that we have. Again, we do substance use for kids and adults as well. We see the kids with Department of Juvenile Justice. And again, what we're really looking at when those kids start using, again, the stuff that kind of Gabby talked about, and I don't want to keep restating what she talked about, but I mean, it was right on. They're struggling with peer pressure. They're struggling with depression and anxiety, family attachments, not having a secure, healthy attachment. And that is where mentoring is a wonderful for those kiddos. It's stuff like that plays into those protective factors that really make a difference, whether it's a kid or adult, really. But we do have groups for kids as well. Actually, we're opening up the Children's Center, which has like 4 huge playrooms in it as well, which I'm so excited about. So again, lots of different options. Do you guys have any questions? Because I can go on and on and on about certain things, but do you guys have any questions?
that was pretty good. If you guys do want to have anything, you could just type it in the chat as well. But thank you, Tiffany.
Thank you.
Now I'm gonna just share some additional resources that are available. So first, Your Life Iowa. This is an amazing website that offers a variety of resources. It's designed to be a go-to resource for all Iowans seeking help with substance use, gambling, suicide prevention, mental health, and more. This website is open to those outside of Iowa as well, I'm pretty sure. Yep. And there's a lot of cool things in there, like there's a facility locator to look for available resources and providers around you. There are screening options available to assess risk for certain disorders. They have experienced and trained crisis counselors available via phone, text, or you can chat through the website. But all of these are amazing, and I would definitely encourage you guys to check that out. The next website is makeitokay.org. So this is a website that works to end the stigma around mental health conditions. They go further into information on stigma. They give talking points on how to start a conversation with someone surrounding mental health conditions, and they give ways to take action to further reduce stigma. So that's a great website that you can check out. There's some local resources. So ASAC, the Area Substance Abuse Council, whose goal is to work on prevention, treatment, and recovery. The Abe Health Center offers a variety of therapy services, or any local hospital, they also have mental health services. There's the Northeast Iowa Behavioral Health, which Tiffany did a great job at explaining. And then NAMI Dubuque has several different support groups available that meet in Manchester throughout the week. So that would be something that would be a good thing to join if you need support. So they have family support groups, substance abuse support groups. You can check out their website to kind of check that out. But lastly, we have coalitions in each of our counties. So Almaquee, Clayton, Delaware, Howard, Fayette, and Winneshiek. If you're not within these counties, I'd encourage you to look to see if you have local coalitions or groups that meet around you. But what coalitions are, they are groups of people working towards prevention and brain health efforts. So it's all about partnership with others to further support healthier communities. If you want more information on any of the above coalitions, you can reach out to the email below. So Leah. Okay, and now we do have time to go through the case study, but this is a case study. Hopefully you gained more information and can utilize that as we go through this, but I'll just read through it. Alex is a 13-year-old girl who has been part of the mentoring program for 1 year. Her mentor, Jordan, has built a strong and trusting relationship with her. Alex is generally an outgoing and creative teenager, but recently Jordan has noticed changes in her behavior. Alex has become more withdrawn and has missed mentoring sessions. One day, during a casual conversation, Alex confides in Jordan, saying that she has been feeling overwhelmed with school, family issues, and friendships. She's struggling to find motivation to get things done. And she also mentioned that some of her friends has been using substances to take the edge off. And Alex admits that she has tried vaping and has considered trying some type of pill to help her cope with everything that she's going through. So we do have discussion questions. So I'm just gonna have you guys look through this and then type out, you can type in the chat box or just blurt out loud what you would answer with these questions, and just share the number of the question that you're sharing. I'll give you a minute for that.
So we've got thank her for sharing. That's definitely good because it takes a lot of courage to even share that. So yeah, perfect.
Okay.
But the last person did answer number 3.
Somebody just put for number 2, ask her how we can avoid doing the things she is contemplating.
Mhm.
Right. Putting it back on her and like giving her steps to come up with herself. That's a good idea. Good plan. But go ahead, Tiffany. You were going to say something.
Yes. So I've worked with a lot of kids, and when they're struggling with at this very beginning of substance use and they really don't want to talk to their parents about the substance use stuff, this is where I talk to them about the mental health side of things. Because if they're willing to talk to their parents about the mental health side of things, and we can at least get them into services under the mental health stuff, they can start opening up about SUD. And what's really cool is federally across the board, at the age of actually age of 12, I think, over 13, don't quote me, but it's one of those. So 13 would fall in there. A kid has control of her record. The parents do not. So if there is any type of SUD that's talked about, that record cannot just get disclosed to a parent. The kiddo has to actually release it. So I kind of let them know about it too, because it gives them kind of power that, okay, I can talk freely. But that's really important to know as you're trying to get them, if they're willing to talk to their parents about, I am struggling with the anxiety or the depression, or I am feeling overwhelmed, just trying to get them into those services.
Yeah, that was good.
Okay, and then we had someone just put, are you feeling depressed, sad, or thoughts of hurting yourself? Yeah,
Yeah,
that's
asking that
important for
question.
sure.
Yep. Asking it straight out too. Like sometimes it might be easier. I mean, you could just kind of beat around the bush, but sometimes just asking it right away can be a good way to get them opening up and talking. Yeah. Those were great answers, guys. Oh, someone else. Validate feelings. Feelings how she is feeling. Yep. Yeah, validating those feelings, making it not stigma, like not using, making, playing into that stigma role and validating what she's feeling. Yeah, great. Well, yeah, just be thinking about different ways that you could answer these questions. But we're running out of time. So before you guys leave, we would love for you to fill out this evaluation. This gives us feedback on ways we could improve our training sessions, and yeah, gives us an idea of how you guys felt about the training. But you can either scan the QR code or use this link.
I put it in the chat too.
Perfect.
So you can click right on it from the chat and it should open it up. And if we have your email, we can always send it to you in email too, and you can take it there. But also if you want the recording and the slides, and I know some of you were asking for the actual printout of the language matters stuff because it was hard to see it on here because it was so tiny. As long as we have your email, we can send it to you.
Yeah.
I think I have everybody's email who's on here except the iPhone, because I don't know who the iPhone user is because it just comes up iPhone.
Yeah. So could the iPhone user type in the chat their name and email
Yeah.
if you want to receive the PowerPoint?
Okay, perfect.
Perfect. Okay.
Feel free to keep asking questions too. We got a couple minutes.
Mm-hmm.
And Tiffany, thank you for being with us all the way from Arkansas.
Yeah.
Speaking on the treatment side of things, that was good to hear.
Yeah, it
Thank you
definitely
for having
was.
me.
Of course. And we'll send the evaluation for anyone who didn't have time to fill that out. But yeah, this is my contact information. If you have any questions for me, feel free to reach out, and I'll get back to you. But yeah, you guys have a great rest of your night. Thank you guys so much for coming.